Greetings, everyone. Welcome. Thank you for showing up to tonight's workshop. My name is Sabrina. I'm the program director at the Eating Disorder Foundation, and I am very happy to be welcoming and introducing our speaker tonight for a discussion about the implications of eating disorders on sexuality. And this evening, the way, if you'd like to communicate or ask questions, Kayla is going to save some time for some Q&A and discussion towards the end of the presentation. And the way we'll do that is through the chat feature. So you can send any questions or messages. Please send them to me directly. You should be able to do that in the chat. And then I can deliver the questions to Kayla, and we can have a conversation so that everybody can remain confidential and also have a chance to ask their questions and speak vulnerably. So as I said, my name is Sabrina. My pronouns are they, them. A little bit about where I work, the Eating Disorder Foundation. If some of you are not familiar with what we do, we're a nonprofit in Denver, and we were founded in 2003. Our mission is to be an effective resource in the prevention and elimination of eating disorders by providing free education, accessible education and support, and advocating for individual clients and families. We are a Denver-based location, though now all of our services are virtual, and we're really lucky to have be providing services for people in different states and even in different countries. So it's really important to know that there's a lot of different experiences gathering and gaining this information, and also giving back information to us so that we know how to best serve and provide information and resources that the community is looking for. I'd like to quickly thank everybody who was able to provide a donation when they signed up for this workshop on Eventbrite. That is how EDF is able to provide free services. So I appreciate that for everyone who was able to. If you'd like to make a donation, I can add a link in the chat as to how you can do that. We're just always so grateful as that's how we continue to do our work. All right, so I am excited now to introduce Kayla, our speaker for this evening. Kayla Peek-Rochelle is a licensed clinical social worker, a licensed marriage and family therapist, and a certified eating disorder specialist supervisor. Kayla has over 8 years of eating disorder experience with children and adolescents, gender and sexuality therapy across the lifespan. Kayla is very passionate about social justice and advocacy and helping patients find accessible treatment. She is the co-chair of the Eating Recovery Center and Pathlight's Diversity, Inclusion, and Belonging Council in the West region. Kayla presents and consults about inclusive care for marginalized populations, including the University of Colorado Psychiatry Hospital Grand Rounds. Kayla has her undergraduate degree in Women's Studies and LGBTQ Studies, her master's in social work from the University of Denver, and marriage and family therapist certification from Denver Family Institute, where she specialized in couples and families within the LGBTQ+ and polyamorous population. In addition, Kayla has training at from Children's Hospital Eating Disorder Unit, and has maintained a private practice where she enjoys focusing on gender and sexuality. Currently, Kayla is the clinical director for the Eating Recovery Center's virtual intensive outpatient programming. So busy, to say the least. When Kayla is not working, she enjoys cooking, traveling, nesting in her home with her wife, and is a big animal lover, has 3 pups, and Kayla also enjoys paddleboarding, reading, and all things hair and makeup. Kayla, thank you for sharing your expertise in the work that you do with us tonight, and a little bit about who you are as well.
Yeah, absolutely. I'm excited to be here. Sabrina and I were chatting over lunch to catch up, and we came, upon this, interlay of eating disorders and sexuality. And Sabrina's like, what if you did a presentation for ADF? I was like, I would love that. This is really kind of my passion, is kind of where eating disorders and sexuality meet. As I'm sure a lot of you know who's on here, a lot of treatment does not address the sexuality piece, whether that's, higher levels of care, outpatient. I don't think it's talked about enough. And this is really something I'm passionate about. So thank you for coming in and sharing in this discussion with me. Those are my 3 pups that Sabrina mentioned. Had to add dog pictures in there. So yeah, I always like to start every conversation, every presentation I do with really acknowledging my identity. I'm a white, middle-class, cisgender, gay woman. And so in those identities, I have a lot of privilege. I have a lot of blind spots. And I never assume that it's anybody's job to kind of point those things out or enlighten me, but I do love feedback. That's how we grow. And that's how we get more info. So as I put in there, I'm not an expert in this topic. It's just something I'm very, very passionate about. Some may say I'm an expert, but I don't think I am. I think I'm just good at kind of researching, collecting data, and then using it to the best of my ability. And I really just want to help increase success for those that I serve and for clinicians who serve this population as well. And so even though I have a lot of experience with child and adolescent, with both gender, sexuality, and eating disorders, this talk is really going to be kind of around adults primarily, but that doesn't mean we can't kind of loop in more child and adolescent discussions either. So one thing that I want to make clear is I am not a certified sex therapist. So I am probably about 4 classes away from becoming a certified sex therapist, but I am not right now. And there's a lot of reasons I'm calling this out, is because it is a very extensive certification that you need to get. And I am not one yet. And so because of my training, I was at Denver Family Institute, like Sabrina said, and it was there when I really started the certification in sex therapy, and that's when we get to pick our specialty, and my specialty was polyamory, which actually was so interesting. I never set out to work with polyamorous couples or partners. And I somehow got put on a list after having one couple of, hey, this clinician is really great with polyamory. And so that kind of became my thing. And then I really started seeing this influx of people within the LGBT community, people within the polyamory community who also had eating disorder issues or disordered eating, body image issues, things like that. And so this is kind of where my passion kind of grew. And so I always joke that I kind of swore up and down I was never going to do eating disorders when I was going through grad school. My mom has a pretty gnarly eating disorder, and so that was something I wanted to stay away from. So really I set out to be a sex therapist. And then the universe had different plans for me. So I am certified eating disorder specialist. So, when we talk about these things, I just wanted to put that out there. I'm not masquerading as a certified sex therapist. I just am passionate about the topic. And then a trigger warning. So towards the end of my deck here, you're going to see some things on trauma, some things on the LGBT community that I'm not sure who's sitting in this conversation with us, but you come with your own experiences, right? Your own trauma, your own way of kind of relating and connecting to this information. And I do just want to give kind of, there's nothing, outstanding in here that, we need to be careful about, but there is some statistics, and we're going to be talking about trauma and sexual trauma and things like that. So I just kind of wanted to give that trigger warning. I'll give it again before we go into the trauma slide, if anybody wants to just kind of step away or something like that. All right, so then when I sat down to do this presentation, sexuality is such a huge topic, right? And eating disorders is also a huge topic. And so I'm like, okay, I have an hour to talk about this and I could go on forever. So how am I going to do this? So really what I did was make this Venn diagram of where does sexuality and eating disorders within a clinical context, where does that meet in the middle? And so this is kind of what I came up with. And the reason I find these two things together so interesting. So eating and sexuality are both a human need or a human function. I put kind of, right, in parentheses because asexuality is a true and valid identity, right? But that's especially as I was training in sex therapy and training in eating disorders, right? As kind of a baby clinician, I came in, thinking, oh, that, I'm going to learn so much about the brain, and I'm going to learn so much about what's going wrong with the brain, right? When really what I know is it has nothing to do with that. It has everything to do with emotions, which we'll get to later. Abstinent models don't work and cannot work for both sexuality and eating disorders, and we'll get to that as well. These are both body-focused issues. It relates to pleasure and self-worth, right? Food and sex. We get a lot of cultural and societal messaging around both of these things that can kind of cloud our success with interacting with both food and sex, right? Both of these have to be looked through a social justice lens, right? So that is one of my biggest things as a clinician is we have to look at this within a social justice lens. Intersectionality is critical when we're looking at this, right? And especially when we're looking at patients, clients, people, right, who struggle with eating disorders, who also struggle with sexuality issues. And I say this all the time about so many things, but especially sexuality and eating disorders. We can't talk about these things in a vacuum. We have to talk about it within a systemic lens, right? These things did not happen because one singular person woke up one day and was like, I think having an eating disorder day is a good idea, right? This happens in a multi-systemic environment. And so we have to look at it in that way when we look at, okay, how do we have these conversations? How do we treat eating disorders? How do we treat, miscommunication, misfiring, and sexuality? So I think the brain's cool, and this really has nothing to do with anything I'm going to talk about, but I needed to put it on here, is right, our drive to eat and our drive to have sex both come out of the hypothalamus. Again, when I was a baby therapist coming into this work, right, I was also in a researching school before that, and so I spent a lot of time looking at the brain and looking at brain scans and all of those kinds of things. And so I really went into being a therapist from this like researcher view of, I'm going to find out, maybe there's a connection, right, between eating disorders and sexuality and things like that for the hippocampus. I haven't found that connection. I don't think anybody has. I just think it's cool. So I just wanted to add that in there. So one of the things that I feel very, very strongly about when it comes to eating disorders and sexuality is abstinence models don't work. So I think this was, I think about 10 years ago, right? Sex addictions became kind of like the new lingo. You kind of heard that in Hollywood and things like that of like, oh, so-and-so is a sex addict, they're going to treatment. what we know is for the most part, I would say 99% of the time, eating disorder professionals agree that food cannot be an addiction, right? And so we also hear this in social media and things like that of, oh, people are addicted to sugar, people are addicted to carbs, right? That's not true. We can't be addicted to food. And we can talk about that more in a little bit. But what experts don't agree on is if sex is an addiction. So there's kind of two schools of thought. That there's this school of thought that, you know, sex is an addiction, there has to be an abstinence model, kind of sends people away to kind of go through this 12-step process and then they come home. Through like certified sex therapist eyes, that's not the case. However, you know, I think sex addiction, and I've even had clients who were in kind of love and I think it's like love addiction or partner addiction or something like that, that it's helped them. And I'm all for whatever helps, right? So I don't want to completely write it off for anybody, but there is this kind of conflict in the field. But what I know for sure is it is never about sex and it is never about food when people come into therapy, right? It is about the emotions underneath. So yeah, I guess I know we're going through the chat, but any questions so far before I keep going?
I don't have anything this far. I will encourage people to, yeah, send me messages throughout.
Absolutely.
Mhm.
All right. And so one of the main things that, you know, I also kind of find is this idea of mindfulness. I think we also throw this word around, right, in our culture. We have to be in our body, right, to listen to our emotions, to our body cues, to know if we're hungry, thirsty, tired, right? We also have to somewhat be in our body and be mindful of our body when we're having a successful sexual experience, right? And what we know is being in your body does not feel good when you're struggling with an eating disorder. And so it can be really hard to have, you know, a meaningful, intimate sexual experience. Not that every sexual experience has to be meaningful, but it's hard to be in your body, right? And so what we know, right, is being in an eating disorder, it really drives you away from both your body and your body cues being connected to your body and your values, right? Your relationships, your life. And so that's really, I think, where the crux of this is, right? Of what does it take to be mindful, right? Of what's going on with your body cues, with the pleasure that you're experiencing, so on and so forth. And pleasure in and of itself is a really, really complicated thing when it comes to eating disorders, right? So I've heard this so many times from, you know, patients and clients that I treat of pleasure, fun, food, it all has to be earned, right? And so at times, right, I think that there can be this idea of, I'm not deserving, right? I'm not deserving of a sexual experience. I'm not deserving of love. I'm not deserving of pleasure, right? So many times, right, I've heard from clients and patients of, you know, my body is a burden to other people. And so to engage in a sexual experience would be putting that burden on someone else, and I'm not willing to do that, right? And it's really the eating disorder leading you to believe, right, that you must earn all of these things, that you're not inherently worthy. Now, for some, I think sex can be a behavior that leads to a resemblance of acceptance, right? And so I don't feel worthy enough, so I need to go search that out through sex or intimacy, which is, I think, can be okay. But in this context, right, of it being directly related to worthiness, it can harm, right, what we're aiming towards of a successful sexual experience, and whatever that definition is for clients, patients. And then the last little bullet point, right? As humans, there's nothing that we need to do to fuel ourselves or enjoy our experiences. We're inherently worthy, but eating disorders tell us we're not. So yeah, I'm wondering, and I mean, you have to chat it, but I'm wondering what you all think about this connection between self-worth, pleasure, and sex. If anybody has any comments.
Yeah, so some comments are coming in that it resonates, that they agree with what has been stated, and also that body image plays a role as well.
Absolutely. Yeah. I think, yeah, go ahead.
Oh, I was just going to share more.
Yeah.
Comments. Yeah, eating disorder and sexual traumas together, combined, add to that feeling of lack of self-worth. Yeah, very relatable. Continues to come in. Yeah.
Yeah. Good. Yeah, I think body image, right, is a huge part of this as well. I think, right, when I think of body image, I think of so there's like body neutrality on one side, right? And then there's body dissatisfaction on the other side, right? Some people can get to body positivity, and good for them. I don't really know a lot of people that can get there in our society, right? But I think, right, when you're kind of hyper focused, and this kind of goes to my next slide, right? When your mind is so full of what is my body looking like, right? So aware, going into that body image distress kind of spiral. And then all of these other thoughts that can kind of pop up within an eating disorder, right? I can only imagine, right? Like, how do you then have sex, right? With all of these things going on, it seems impossible, because you're drowning, right, in all of these thoughts. This next slide, I kind of just copied and pasted, and I know there's a lot of highlighting in here, but it was the only way that I could successfully say what I wanted to say. So this is the trauma slide. So if anybody needs to step off or to just kind of take a moment, please do. But this is, someone commented about the trauma piece, and this is a huge piece of this. So this research, every time I research trauma and eating disorders, no matter how many times I look at it, it shocks me, to be honest. So this, this particular study, and I have a bibliography at the end, if anybody wants to research it even further, but the 67% of patients with eating disorders experienced a traumatic event in their life, which I think that this is probably higher than 67% if I had to guess, just based on, my career. I would almost guess that this is probably 80 to 90%. The one thing that I kept repeating as I was doing this presentation and putting this together is the median time between a sexual traumatic experience and an ED diagnosis was 3.4 years. However, the median time between sexual trauma and the onset of eating disorder symptoms was 0 years. Right? So what that tells us is sexual trauma happens, right? Eating disorder symptoms, behaviors, thoughts can pop up almost immediately. That's super significant to me, right? But most of the people goes on an average of 3.4 years before they're diagnosed with an eating disorder, right? And in my mind, that means before they actually are getting some kind of help, right, for this. That's a long time after a traumatic event. And then it says 50% experienced sexual assault. So that, I mean, super, super, super significant. And then in this second paragraph here, talks about childhood emotional abuse, and that this really leads right to this self-critical belief, right? And I say this all the time with my clients and my patients, right? Is typically what we're told in childhood is what we internalize and what we tell ourselves, right? And so those self-critical beliefs that we carry on, right, is it's going to have an impact in how we see our physical self, which is exactly what the study showed. And then this last bit of information, a recent study found that beliefs related to mistrust, and abandonment issues, things like that, equaled, right, a drive in fitness, fear of abandonment, obviously. And we see that a lot with bulimic symptoms. This is a lot in one slide. So I also kind of extracted this from that first article that I mentioned. This kind of talks about from a cognitive behavioral therapy perspective of how this kind of happens, right? So if we think about, okay, there's this traumatic event and it disrupted the belief system that we had, right? Which that's how trauma works, right? So we go throughout our day, say there's a hurricane, right? That's gonna throw off our trust in, okay, maybe my home isn't safe, right? Am I gonna have to worry about this next time, right? We see this with traumatic events. And then there's this growth of this, they call it secondary non-intrinsic emotion. What I would call this is our core emotions, right? When you peel back the fear and you peel back the helplessness and the hopelessness, right? It's guilt and shame, right? And so what we see is guilt and shame then takes over, because we, for whatever reason, our brains like to internalize what's happened to us, and connect it to something that we did, right? So for example, right, a trauma happened, maybe a sexual assault. What does our culture tell us, right? Blame the victim, right? You should have maybe done something different, right? All of those things, and we internalize that. And then it grows in guilt and shame. And what happens with guilt and shame? Maladaptive coping behaviors always happen when there's guilt and shame there, right? And so you can see that in that little gray box where it's just this cycle of, they pick binge eating and I think some other behaviors down there, right? But what we see is this cycle that's really hard to get out of until we're able to release some of that shame. So it's really interesting. I was in charge of doing the binge eating programming for kiddos on site. And we would call them shame stories. And the kiddos would have to kind of share the most shameful thing that they could think of in this group in a really safe, productive way. And the shame and the guilt that even kids would experience was insane, right? But what we saw by the end of that group is some of that shame lifted off, right? Maybe they weren't, totally cured of their eating disorder. Most times they're not when they leave treatment. But they knew that they had a place to talk about this shame and this guilt. And they knew, what we would try to do is get them to talk about it with their family too, so they could go home and continue to talk about this guilt and shame. Because again, that's the number one way of leading to eating disorder behaviors, I think. Sabrina, I saw that you unmuted. Was there something in the chat?
Yes, there's a lot of things happening in the chat. And first I want to just say thank you for everyone who is sending in and to give me a little bit of time just to make sure I can respond and also deliver things that honor what you're sharing and that kind of line up. So don't worry, I'm keeping things in the back of my mind if I haven't shared something that you've sent me. But so far, the statistic slide and this image that we're on now has been very validating. Although it's right, it's really understanding that so many people are carrying trauma, and to even though have the awareness that like we're not alone in their experiences, because you're sharing about the immense shame and guilt, and whether that's in our youth or starts in our youth, I think for many people, or at a different age, I think those two things then really keep us in isolation of our experiences, and knowing and understanding that very unfortunately, these experiences are more common than we feel like they are. And just the power of isolation that keeps us separated and quiet and from moving through the guilt and the shame. So just a lot of
that sentence that you just said, it gave me, and I actually have goosebumps, because that is right. The whole piece of this is we don't talk about this, right? We don't talk about this trauma. We don't talk about, what goes on in our childhood. We don't talk about what happens in those traumatic moments. And then there is no place for us to talk about guilt and shame, right? And I think one of the biggest pieces that eating disorder treatment misses is how does sexuality, how does traumatic sexual events, or just traumatic events, right, impact us? I don't think there's enough space for that either. So that resonated with me. Any other pieces on this? Because we're going to just shift a little bit off trauma.
Well, I wondered, there was a question a little bit ago, how, if you are going to come back to when you mentioned that addiction isn't really the way the eating disorder field talks about the behaviors that happen in eating disorders, or even recovery. So because someone was wanting to clarify just those statements of addiction not being a way to describe an eating disorder with food or even with sex, as you're kind of relating. Are you going to talk, or can you talk a little bit more about that in regards to, I know sometimes there's research out there that is like, well, here's the biochemical side of why we say things are an addiction and how our bodies and the chemicals in our brain are responding to something. And then also, I think another really large way that we talk about it in groups or in conversation or in, with our practitioners is, do I like ascribe to that identity, and how would that impact my definition of what recovery means and looks like? Okay. So I know there's a lot there. So I'm wondering where you might expand a little bit about the addiction piece.
Yeah, so I think, in just I'll kind of just talk about my experience, my knowledge, and kind of branch out from there. So I think again, when we kind of look at, when I look at addiction, right, and I am saying this not as an addiction counselor, but when I think of addiction, right, that those tend to be things that, right, there's a foreign substance, one. Two, it tends to be, I don't know how I want to say this, but it tends to be more of a I don't want to say that either. I'm trying to choose my words carefully. One of the things that I think sets it apart, right, is food and sex are things that we can't go without as humans, right? Now, I put that little asterisk because people can go without sex if they choose to. But if someone is a sexual being, they want to have sex, all of those kinds of things, I typically don't find that it's helpful with them entering this like abstinence model of, okay, we're going to take away, because in that sex addiction model, they kind of go away from their family, their spouse, all of those kinds of things, for maybe like a month, right? And then they kind of come back and try to get integrated again. That kind of just goes against how I think people should be treated, right? In that systemic view of, okay, if you're struggling with out of control sexual behaviors, that's probably happened in a system that there's other things going on than just the patient, right? Struggling, right? There's maybe some family dynamics. There might be, maybe someone cheated in the past. And so we have to heal from that. And so from like a fundamental level, I don't agree with let's pull somebody from their environment to get to heal them, right? So that's one piece. Another piece is, I think there's been a lot of studies shown in the food world of that, when somebody engages with sugar or carbs or all those things that we tend to say are food addictions, the same thing that happens in your brain when you drink or use a substance does not happen when you eat sugar or carbs or things like that. And so it's something different that happens in the brain. I don't know enough about the sex research per se to say like what happens in the brain. But what I do know, right, I think I was in that slide too, I was saying, if that model works, right, I had a sex and love patient who attended sex and love addiction classes, and that really worked for her. However, she did not follow the abstinence model that they set out either. And so she only ascribed to what was helpful for her. And yeah, I think, she needed her partners, her friends, all of those things in those moments to be able to help her kind of move forward, if that makes sense, where the abstinence models tend to be a little more black and white.
Thank you. I'll also share now a couple of other comments just about people, the different ways in which behaviors of the eating disorder are used to sometimes either feel more separate from our bodies because it's overwhelming to handle what's happening, and also sometimes to feel again and to have something then reconnected with the body, and just the variety of experiences that can happen through that.
Absolutely. And I think sex is a part of that, right? Like, there's been many clients that I've worked with, right, that use sex in a way to maybe feel something, right? Or to kind of numb out, or, whatever it is. So I think that just like food, sex can be used in those ways too. All right. So moving on to LGBTQ, I think this is another kind of interesting intersection of what we know is LGBTQ community are at a higher risk for eating disorders. And I think there's various reasons why that is. So this is straight from the NIDA website, but I think this kind of hits it on the head. Right, they fear of a rejection, right, for their sexual orientation. That how do you, if you're fearful of being rejected, what do? You stop being yourself. You internalize messages that you heard from your family. That shame and guilt pops back up, right? And what we know, shame and guilt often leads to eating disorders. Experiencing violence. So what we know is LGBT community experiences higher levels of PTSD. And this is, due to bullying, due to, horrible sexual experiences, sexual assault, rape, things like that. Discrimination. I mentioned being bullied in the past. This discordance between, what sex you were assigned at birth versus your gender identity that you identify with now. And then inability, the last one is a huge piece, I think, an inability to meet body image ideals. So one of the research projects I worked on in grad school was kind of looking at, okay, what are the body image ideals in the context in which we live in society-wise, and then what is that for LGBTQ, right? And what I found is really there's two worlds, right, that queer people kind of have to live in, right? Of I have to, maybe be a certain way with my family or at work, right? I have to look, act, behave a certain way. And then when I'm in this queer community, there's this pressure to feel, act, look a certain way as well, right? So there's this double bind of, right, of having to look the body, especially the body, right? And if we think of, I remember I did a presentation once of, all I did was I looked up like pride events, like Googled it. And then when I went to images, it was literally just pictures of people's body, right? And so I think there's a lot of freedom in that, right? And I'm all for all of that, right? And at the same time, I think, especially LGBTQ folks, there's this hyper focus of the body, and there's the hyper focus of sex, right? When culturally we're looking at this community. Again, there's freedom in that, and there's things that I'm all for in that. And at the same time, I think that hyper focus can be really hard, especially for kiddos, right? Or teenagers or young adults who are trying to figure out where they fit. And so to me, it makes complete sense then why an eating disorder, it seems like the only path forward, right? I get to control how my body looks, right? I don't have control over maybe my home experience. I don't have control over how people identify me, how they misgender me, all of those things, but maybe I have control over this. So I think there's a lot. We could spend hours on this topic, I think. But yeah, anything that's coming through about this slide?
Let's see. Not so far on this slide here.
All right. And so I think, what we know is culture, society, the rules around it, the messages that we get. We've talked about this throughout the presentation, but I do think that this is one of the biggest pieces, right, of especially for LGBT youth. And again, that kind of double bind. So treatment, right? So I think this is where, it kind of depends on the person. But, if someone's coming to me and they're like, I'm experiencing eating disorder behaviors, thoughts, and I'm also struggling with sex with my partner, or I'm also struggling with dating, or I'm struggling just being touched or looked at, right? The first thing that I'm gonna say is, let's work on your eating disorder. That's gonna be my number one. Now, that doesn't mean that you can't. Oftentimes I do couples therapy in eating disorder treatment. So that doesn't mean you can't work in tandem with those things. But I think to have that solid base of eating disorder skills, coping skills, and decreasing those behaviors can be super helpful before you kind of bring up all of the shame and guilt and emotions that are tied to your relationships, right? CBT, that, trauma wise, I think that's a huge one for people who've experienced trauma. For those of you who don't know what it is, and I'm blanking, it's cognitive something treatment. I'm forgetting what the P is. But CBT is basically, it's about a 10 to 15 week trauma treatment that it kind of exposes you to the trauma to a point where you can, my favorite metaphor is like, imagine your traumas in a linen closet. And so if you open the linen closet, most people's linen closet, like mine, things fall out and, things are everywhere and right. And so it's kind of like opening your linen closet and not, getting to a point where you're not overwhelmed, where you can manage just opening it. So that's kind of the point of CBT. Group therapy, I think, can be super helpful. I think, again, this is where we get into not a lot of clinicians feel comfortable talking about sexuality in a group setting. And so it can be really hard to bring in some of these things, but, I think it's definitely something that is worth looking into. Partners therapy, super helpful. And then in terms of, okay, I want to look for a couples therapist. Where do I start? A sex therapist from ASECT. So that's the Association, American Association of Sex Educators, Clinicians and Therapists. And so that's kind of the really rigorous board that certifies sex therapists. And so you can go to their website, type in your area code, and it will come up with certified sex therapists in your area. I would say, a fair amount of sex therapists do understand body image issues because it comes up all the time in sex therapy. But I think as long as you're working in tandem with an eating disorder therapist, that'd probably be the best. And then I'm always a big fan of yoga, movement therapy, art therapy to get in your body. The more practicing being in your body and exposing yourself to the uncomfortableness of being in your body, the better. So yeah, those are kind of the things that in my experience has helped my patients and clients.
Kayla, so we're getting some additional questions about CPT, and I'm thinking when we send the recording, maybe we can send a resource to kind of explain a little bit how CPT is a little bit different than cognitive behavioral therapy. It just more so what it focuses on than some of the other therapies, even that you've listed here too.
Totally.
Yeah.
I can totally do that. All right, we're right at the 10-minute mark, so I did it.
Perfect. Okay.
I wanted to leave 10 minutes for discussion, questions, things like that.
And we've collected some really good ones already. So I'll go ahead and begin. And if people have not yet sent me a message, please do so. I'll still save them, and if we don't get to them today, and then try to address them when we send out the recording.
Awesome.
So Kayla, can you share in ways that you've worked with clients and experiences around sexuality and eating disorders and body image? Can you share some things or some tools or ideas or conversations that you have with ways to connect with our bodies while we're in eating disorder recovery and trying to get more in touch with our sexuality?
Totally. I think one of the biggest things that I advocate for, I kind of have this metaphor of treat yourself like a plant, almost, of like, make sure you're getting sun, make sure you're getting water, make sure you're like sitting on the ground and like grounding yourself, right? And I think just doing those simple things, right, of, okay, I've been in the house, or I've been running around and blah, blah, I'm going to go sit out in the sun and just enjoy the sun, and taking 10 minutes or 5 minutes, right, to kind of feel the sun on your body and really explore what that feels like. Even that can be really scary for some people. And so taking it at your own pace, some people need to start there, right? Of, I'm just going to, explore what sensations feel like on my body. Other people are ready to kind of jump in of like, I want to do this more with my partner. I want to feel, safe with touch with my partner and things like that. Sensate focus therapy is one of the things that sex therapists use. And that's, again, it actually has nothing to do with sex. It's really just about touching your partner and, touch that feels good. And so there's a huge spectrum in terms of where you're at in recovery and where you're at with comfortability of, okay, do I need to focus on just, you know, being in my body, focusing on sensations and learning what feels good for me? Or can I do this with a partner and kind of work it out with them? So I think it can be, there's a lot in between there. And of course, yoga, I'm very biased. Yoga, mindfulness practices, all of those kinds of things can help you get in your body too.
A lot of these things you're sharing are still very difficult. So yes, there's this, it's good information to have. And I also think it's still challenging to hear that so much of this is similar to what we hear in eating disorder recovery, right? And like, yes, when we talk about body image, which, you know, you are mentioning and talking about. So just that we're having this conversation really for the first time at EDF in the community, I'm so grateful because it is already highlighting so much of the overlap and just kind of taking down like the fear of having this conversation, you know, and that there are so many people who have experiences that are, that they may not even be at a place where they feel I can say this out loud, or I don't want to bring this up because I'm not ready to deal with what may come with it. And that crosses over so much into our recovery, really.
Absolutely. And it all ties back to shame, right? Like, you know, if there's not a safe place to share that shame, to share those stories, then it's really hard to even get to the point where being in the body is safe, right?
Mm-hmm. Can you, I'm kind of switching gears for a moment. Can you talk about what happens, or is it normal, is the question, for people in their lifetime to have a sudden shift in sexual interest?
Yes, 100% normal. Sexuality and sexual orientation, sexual preferences, that shifts throughout our lifespan. So yeah, 100% normal. And yeah, I actually often get this question from clients and patients of like, you know, I have been in this relationship with, you know, my husband for this is just an example of like, you know, for 10 years, and all of a sudden I have this, you know, desire to maybe open a relationship or maybe explore things with women. And I can't tell you how many times that's happened. I think, yeah, more often, again, it's because people don't talk about it, right? And so everyone's kind of walking around probably feeling the same way, but because no one talks about it, it feels like a taboo thing.
Yeah. And they're not values. Well, they're tied into values, but just how, well, what am I trying to connect here? So there's a lot of comments around you bringing up and validating the LGBTQ plus community, and for a lot of things, the intensity of how hyperfixation on what bodies look like or what someone in the LGBTQ community feels as far as validation goes with appearance is very real and very intense. And it's also like our general culture and society, no matter your sexual orientation or gender. But I think that like there can be even some additional places where people might be looking for understanding and connection and only find there to be additional pressure. And how do we come to those with like what our needs are and what our, if we don't know, like we're still discovering what our values are and what we want, who we are, who we want to be, and how that will continue to develop. And to me, that's so similar to what eating disorder recovery is, which is we go from finding recovery in how do I manage my feeling in my bodies, how do I discover different ways to different ways other than the behaviors that I've used or have used. And yeah, and so sometimes there can be like so many different layers coming and making that very challenging. Can you tell everyone what are some good questions that they could ask themselves as to when may I decide I want to go see a sex therapist?
Yeah, I love this question. I think one, if you're looking to explore these pieces of yourself and you feel ready, I think go see a sex therapist, right? There are clinicians that are okay, right, with no, we can talk about sex in here and things like that. But I think if this is something that, you know, is really important to you and you want to explore, I would say go see a sex therapist. I think another thing is, if in particular in partner work, right? If there's like things that you want to work on with your partner in the context of your relationship, and there's multiple things. So let's say, you know, like, okay, we don't argue very well, we're not having sex, and we're blah, blah, blah. Go see a couples therapist. You may not need a sex therapist for that. But if it's like, okay, our relationship's great, and maybe we have a mixed match of desires, right? Or, you know, I really struggle because of my body image and my partner doesn't. Go see a sex therapist. You know, I think if it's kind of this singular issue in the relationship. I think also if you're feeling like your sexual behaviors or your sexuality is getting in the way of living the life that you want to live. And that can look different for a lot of people, right? That can look like out of control sexual behavior. That could look like, you know, terrified, right? Like, I'm terrified to enter a sexual relationship. You know, if any behaviors, thoughts, emotions tied to your sexuality is inhibiting you to live the life that you want to live, I'd say go see a sex therapist.
I have another question that is shifting gears, bringing in another intersection, which is, do you have anything to share with those who are struggling with a chronic illness, in addition to an eating disorder and maybe some, you know, sexual trauma? So in addition to that, you know, sex being painful itself in a variety of ways. Do you have any additional resources or comments around that?
Totally. Yeah, I think I can send this to you, Sabrina, too, when I send over the CBT stuff. But there's a researcher who her last name is Katz, Katz, if anybody wants to look her up. She does a lot of work around sexuality and disability. And she is, I think, one, it's just validating to really read her research and kind of what she finds. Also, Sonia Renee Taylor's book, The Body's Not an Apology, that talks a lot about disability and body neutrality. I reread like that first section that she talks about, you know, her friend who had sex with, you know, unsafe sex, and was like, well, I felt like I had to because of my disability. No one would have sex with me otherwise. I like read that often to remind myself kind of where my patients and my clients are coming from, because it's so powerful. And again, that's something that's not talked about. Like, even in this presentation, I left it out. But yeah, I think, and I think with other intersections, like when you think of, you know, people of color, right? That within society, the context of what sexually their messages that they get about their sex and their body and things like that are completely different. And so, yeah, we could talk all day about those little intersectionalities too. But yeah, Sonia Renee Taylor, and then I'll send you the researcher's name too. I'm blanking on her first name, but her last name's Katz, and she's at University of Michigan.
Okay. Thank you so much, Kayla. We've met our time. And I'll just remind everyone that we will, everything that we've discussed, kind of put together some resources when we send out the recording. So you can click and follow along and find even additional things to continue, because you're right. This is like just the very introduction of something that we could probably do a series on. So Kayla, I really appreciate you putting this together for tonight and for our community, and all the work that you do.
Absolutely. Thank you everyone for joining me. And this is my email. If you want to email me, if you need any other resources, have questions, even if you need referrals for like, hey, help me find a sex therapist in the area, anything like that, please reach out.
Oh, that's very kind of you. I'm going to put your email in the chat.
Yeah, absolutely. And I'm seeing some familiar faces too, which makes me so happy.
Oh, that's wonderful. Thank you everybody for joining tonight.
Thank you.
I hope everyone has a wonderful evening.